There, my dear listeners. My name is Nath Arwa, your antimicrobial steward. And in this brief video, I would like to talk about a world without antimicrobials or antibiotics. I would like to start us off by commenting about the pre-antibiotic age, the era before we began using antibiotics in therapy. Now, in a world before antibiotics, people often succumbed to infections such as pneumonia and meningitis. And simple medical procedures, simple surgical cases were highly risky because of chances of post-operative infections. Now, antibiotics have changed that as we know it today. It has become possible to avert bacterial infections after surgery using promptly infused or administered prophylactic antibiotics. Now, it has become possible to use antibiotics prophylactically even after administering chemotherapy for cancer patients. It has also become possible to treat meningitis and pneumonia and other bacterial infections today because of the antibiotics that are available. Next, I would like to comment about the antibiotic age. Life after the emergence of antibiotics in therapy as we know it today. Now, since the 1940s, our antibiotics have allowed us or enabled us combat, fight, or treat infections caused by bacteria. And this has led to many millions of lives being saved. But the sad state of affairs is that antibiotics are becoming ineffective against many bacterial infections as we know them today. And that is because they are not being used appropriately. Now, unjudicious use of antibiotics has driven the emergence of multi-drug resistant microorganisms. Now, these multi-drug resistant microorganisms are usually treated with second and third line antibiotics, which tend to be more expensive and in most cases more toxic. Lastly, I would like to comment about the post-antibiotic age, which stares us in the face unless we take responsibility and use our antibiotics appropriately. Now, the pharma industry lacks the enthusiasm to manufacture new antibiotics since resistance emerges very quickly and they do not get returns for their investments in manufacturing novel antibiotics. In a nutshell, the antibiotic pipeline remains dry. Now, this points to a very gloomy future. Now, if bacteria become resistant to our antibiotics, many routine treatments and surgical procedures will become increasingly dangerous. They may have repercussions. They may end up in fatalities. Now, our heavy reliance on access to antibiotics that work in cases such as setting of broken bones, basic surgeries, and chemotherapy is a fact that I cannot shy away from. And antimicrobial resistance is one of the biggest threats that is facing us today. It's a grim reality, and we have a chance to fight back. You and I can both positively contribute to this battle by visiting the site www.preantibiotic.org antibiotic guardian. So my dear listener, let's journey together and make a difference through responsible use of antimicrobials or antibiotics to avoid a future without antimicrobials, to avoid the post-antibiotic era or age, or else we will be wiped out of the surface of this world by infections caused by these bacteria that have unfortunately outsmarted us. And if this brief video helped you in any way, make sure you give it a thumbs up and subscribe to my YouTube channel. The best is yet to come. Thanks for watching and have great antimicrobial stewarding or stewardship. Thank you.